Hello friends. In today's video, we are discussing something that is running in news again, that is related to a WHO report about India. Okay, it is actually talking about all the countries in the Southeast Asia region. If we see this, WHO says Southeast Asia region tops in vaccination recoveries following pandemic thanks to India and Indonesia. Okay, so India and Indonesia, both the countries have contributed significantly to bring Southeast Asia to the number one position amongst all the regions of WHO. Southeast Asia has come to number one position in what? In vaccination related recoveries. Okay, amongst this, India has recorded an all-time high of 93% coverage of third dose of DPT3 vaccination. Okay, DPT3 immunization coverage in 2022 as per WHO. So what does this DPT3 stands for? DPT3 में D stands for diphtheria, P stands for pertussis. This is also known as whooping cough, and the T stands for tetanus. So in the third dose of these three vaccination, India has achieved a 93% coverage. It's a very significant number. If we see, in the pre-COVID times, we have achieved till 91%. Because of COVID in 2021, it decreased to 85%. Okay, now post-COVID, we have been able to bring this number to the pre-COVID levels or more than that. Okay. We have also seen improvement in measles immunization coverage up to 6%. 6% coverage has been improved, and we have come to a number of 92% in 2022. So we can expect for the eradication of diseases such as measles plus diphtheria, pertussis as well as tetanus. Okay. Another very good news is the zero dose children. Zero dose children matlab those children who have not achieved immunization for any disease. Okay, zero dose children, we have reduced their number in 2021 from 4.6 million to 2.3 million in 2022. Matlab within 1 year, we have half this number of zero dose children. Okay, amongst the other observation of WHO, it also says that within the subnational level, matlab in the state level, within the state regional level, there are variations. Matlab there are certain pockets wherein there are much number of immunization coverage is done, whereas on the other hand, there are certain pockets wherein vaccination or immunization coverage was much below than the usual average also. So there are variabilities at the subnational level, and there are certain accumulation of pockets of unvaccinated children. And the problem here is, if this task is half done, it is not done, because if we have certain pockets where the children are not vaccinated, that means these children are capable of carrying a certain disease. That means these children can, these disease can spread to the nearby regions. Even if they are vaccinated, we have a greater chance of them facing a particular disease. So we will have to get hold of these pockets and eradicate by improving the vaccination drive in these areas also. Okay, so this is the news. This data we can actually use in exam. So how we are discussing this is, we will be starting up with health, okay, and we will be covering every aspect related to health. All the data that you can use in your mains exam, all the mains pointer that you can use in writing your exam. Okay, so with respect to health, any kind of question you can expect in UPSC mains exam, we will be covering it here. Okay, so these were some of the data that you can use in exam. Also, coming to the immunization drive in India, okay, this was the report. As of now, we were discussing the WHO report. Now we will be moving to what is going on in the immunization program of India. In immunization program, we have a mission Indradhanush starting 2014-15, wherein we were vaccinating children less than 2 years of age for 12 life-threatening disease. This was applicable for children whose age is less than 2 years, and the vaccine for them, free vaccine will be provided for 12 life-threatening disease. These diseases include TB, diphtheria, pertussis, also known as whooping cough, tetanus, polio, hepatitis, measles, rubella, JE, Japanese encephalitis, and rotavirus. And there is one more disease by the name pneumonia and meningitis due to influenza type B. In common, we call them as hemophilia influenza type B. Okay, so for these 12 diseases, In those areas where vaccination is not done or they have been partially vaccinated, children have been partially vaccinated, we will get hold of these areas and conduct the vaccination drive in these areas for these 12 diseases for children less than 2 years of age. This was the idea of Mission Indradhanush, which began in 2014-15. This Mission Indradhanush had a target of immunization coverage of 90%. This we were not able to achieve till 2017. So, in 2017, we came up with intensified Mission Indradhanush. Okay. Intensified Mission Indradhanush again kept the target of 90% coverage beginning in 2017. Same, children under 2 years of age plus pregnant women who have been left under the routine immunization program. Those pregnant women who have been left under the routine immunization program, for example, pregnant women are provided with the vaccine of tetanus. Okay, so if they are left under routine immunization program, we will be covering them in IMI, that is Intensified Mission Indradhanush. Also, because there were certain pockets wherein vaccination was not completely covered, so we will be targeting those high priority districts and in rural as well as urban areas and conducting the vaccination drive. So, Mission Indradhanush itself was intensified in these high priority districts starting 2017. So, we call it as IMI, that is Intensified Mission Indradhanush. Okay. Now coming to some of the analysis of data or the status of health sector we are discussing here. What does NFHS 5 say? This is National Family Health Survey. National Family Health Survey has come up with its 5th report, which is saying that India has achieved a TFR rate. TFR stands for Total Fertility Rate. TFR rate of 2.1 by 2020. We have achieved this target in 2020 itself. Okay. This was targeted to achieve in 2041. We have achieved it in 2020 itself. Okay. So, this is a very good news coming from NFHS. TFR actually says that a woman in her fertile age should produce maximum 2.1 children. It's a very odd numbers to say. 2.1 children is not a possible number, but we are talking about the average of the country. That is why it's a decimal number. Okay. So, India has achieved TFR rate of 2.1. Okay. Also, the institutional deliveries in Bimaru states has increased to 89%. This Bimaru states we have discussed earlier. It stands for Bihar, Madhya Pradesh, Rajasthan, Uttar Pradesh as well as Odisha. So, institutional deliveries in these states have increased to 89%, which is again a very good number, because in these states we were expecting the social indicators to be very poor in number. The social indicator including that of health or that of education, these were very terrible states. These were in very terrible states in these states. Okay. So, institutional delivery improving to 89% is a significant development as per NFHS 5. Okay. Some of the other news that has been, some of the other reports that have been come up under NFHS 5 or some of the observation, it says that 4 diseases, cardiovascular disease, cancer, chronic respiratory disease and diabetes. For these 4 diseases, we have witnessed an increase in number of patients. Okay. The cause being mostly unhealthy diet, lack of physical activity and use of tobacco and alcohol. Because of these kind of unhealthy living practices, we have witnessed an increase in these 4 non-communicable diseases. Related to NCD, NFHS 5 also says that 38% deaths were observed in related to NCD. Related to non-communicable disease, 38% of deaths were observed in 1992. But this has doubled in 2016 up to 62%. Okay. So, all in all, what we can see is there is a significant increase in the non-communicable disease related deaths or increase in such patients. Okay. Also, obesity has increased from 19% as stated by NFHS 4 to 23% in NFHS 5. Okay. So, with that we come to the end of this video today. We will be continuing to discuss health related aspect in this video series and ensuring that there is a 360-degree coverage related to any topic being asked related to health in the mains exam. Okay, as of now, we will conclude with this. Thank you so much and all the very best.